Hello, and thanks for joining us for this video case tip, where we're going to give an update on the Senate Health Bill, the Better Care Reconciliation Act, now that we have a CBO score. I'm Brynne McBride of ABC for Health.
And I'm Bobby Peterson.
We're going to remind our viewers what the Senate bill is, what the CBO score had to say, and then what the impact is on Wisconsin. So let's go right into it. This is the Senate's version of a bill which they claim to repeal and replace the Affordable Care Act. Like we said, it's called the Better Care Reconciliation Act. It's a little bit different, but it's got a lot of similarities.
It's pretty close to the House bill. I'm surprised in some ways,
Act.
right? And I think that it's a little too heavy on repeal and probably not enough emphasis on repair, which is where the American people seem to be landing more so.
Right.
We'll talk about that.
Some recent polls, the people are saying we didn't find that much wrong with the Affordable Care Act. And to go in and do what this bill does, really gut Medicaid, is really
right.
Extreme.
I think that's one of the things that's most alarming about this is how it really takes a wrecking ball to Medicaid, gets rid of or creates per capita cuts. You know, it's a kissing cousin to block grants.
Yeah.
It gets rid of the entitlement and eliminates the Medicaid expansion, which I think covered a lot of folks out there. And again, I think that public opinion is way ahead of the Republican talking points on this that seem to be stuck back in like 2009, 2010. They haven't evolved with the American people about how important programs like Medicaid are, how important coverage is in the elimination of pre-existing conditions. So,
and there are some Republican governors out there saying, don't take away our Medicaid expansion. We're relying on that in our state.
It's a budget issue. It's a human issue. It's it's
a
really
taxpayer issue.
Absolutely.
If the feds aren't going to pay for this kind of Medicaid, the state taxpayer ends up, if the state's going to do anything at all, which is what we have in Wisconsin. What else it does? That was the Medicaid side, cutting Medicaid, creating per capita caps, and phasing out the Medicaid expansion. On the private insurance side, we're seeing that end to the individual mandate overall.
So that's gone, and instead they're going to try and enforce some pre-existing condition limitations by making people, penalizing them if they switch plans and have more than a 63-day gap in it.
Yeah, gap in coverage.
So that's their way of dealing with it. So pre-existing condition could become a big issue again.
We're gonna, talk about the bad old days of insurance. Bringing back high-risk plans or trying to pre-existing condition exclusions. That's where this is leading to.
Right. Not a good idea.
Right. And there's more in the details. Getting rid of some tax credits. For the wealthy and on manufacturers and medical device companies, replacing a new system of tax credits for people for premium assistance, and then, like you said, giving states flexibility, which could be to drop some essential health benefits like maternity coverage or emergency room services.
So that creates barriers for people. If you happen to be in one of the categories that they drop the essential health benefits, then you have that pre-existing condition and no protection. So you're kind of stuck. The plans are less generous. There's higher co-payments and deductibles. The actuarial values, which is the technical language of the plans, drops quite a bit.
Right, which means that the middle of the road plan now becomes a much worse plan.
Yeah, they're shooting for the bronze level plan as being sort of the standard plan, which is really
is the new silver.
Yeah,
which is that's not the direction people need to be going. So there was much anticipation before this CBO report. Congressional Budget Office gives a score where they talk about the impact of the bill from both a person and a cost perspective.
Right.
And let's look at the person cost first.
It's going to shoot the uninsured up by 22 million. They reduced the number from the House bill from 23 million down to 22 million. Not worth really, mentioning. It's a big number. A lot of folks are going to be on their own in terms of insurance.
And this is an additional 22 million to the people that would have been uninsured anyway. It's not like it's 22 total. This is going to look more like 49 million uninsured by 2026. The money side, this is some of the numbers that folks were waiting for, was what is this going to look like for a Budget Deficit Reduction Act? And they were, the CBO was reporting it's about a $321 billion net reduction in spending. But if you break that down by line item, you're seeing a bigger part of that reduction is to Medicaid. $772 billion cut to Medicaid.
Right. And there's arguments both sides saying, well, it's only, it's the Republican version of bending the cost curve and saying we're reducing the increases to Medicaid. But going from, from standard, health care inflation to standard inflation makes this a pretty big drop. And it also, when the program is capped, it makes it very difficult for people to expand coverage in emergency situations or to extend coverage to groups that may need help. It ends up being, the potential for really restrictions on access to health care and even rationing.
Right. Well, and you referenced this quickly. These projections, the Senate bill uses the Consumer Price Index as how per capita caps would grow over time, which is a much less generous growth pattern, which means states are now put in that position of deciding, do we cut eligibility or do we cut services for this group?
Right, and it might be a state decision then to have to increase costs and taxes at the state level. So it's a shifting of responsibility, operating much more differently than the Medicare program does for senior citizens.
Right, which is a good point. This looks dramatically different than what we're used to when you think of insurance that's provided through the state or the federal government.
And some additional consequences for Wisconsin because we didn't accept the Medicaid expansion funding. The Senate maintains funding for states that did for a period of time, and that could have put Wisconsin in a better financial situation. We probably could have had some extra GPR for some of the roads that they're quibbling about right now.
Right.
But a Missouri Hospital Association report said that states that didn't accept the money could lose out on $684 billion in additional federal
This was reported through the Milwaukee Journal Sentinel. Came out.
Jason Stein.
Quoting this number, it's a big number.
Yeah, $37 billion loss for Wisconsin alone. That's huge.
Yeah.
And it's startling to see, but we've been saying this for a long time, that the failure to accept the Medicaid expansion fundings wasn't a stroke of genius. It was a stroke of foolishness. It was opportunity for Wisconsin to bring some federal funds back to the state. It was a way to help promote access to health care with it, which is less complicated for people. And it also helps to bring in funds to help build the infrastructure of our state. And I mean the medical and healthcare infrastructure that's important.
Sure, and you referenced the cost that Wisconsin has already paid for not expanding Medicaid, and that number was quoted as $679 million.
Yeah.
Same article in the Journal Sentinel reporting that number. But there are other things, and not just the money that was potentially lost and the money that could be lost in the future because we didn't expand Medicaid. The way that per capita caps would be created would be based on your Medicaid spending in 2016.
Yeah.
And because we didn't do the Medicaid expansion, that means that we start already behind the eight ball.
Yeah.
We're already at a much lower funding level than other states that did expand Medicaid would be. And some are projecting that in Wisconsin that could be less than half of those expansion states. So, I mean, money-wise, a huge impact, but we're not forgetting the person impact. This Senate bill impacts everybody.
Yeah, so don't think, well, I don't have an Affordable Care Act plan or I'm not on Medicaid, so this doesn't really affect me. I'm going to stand by the sidelines. It affects everyone in Wisconsin. Medicaid, private insurance, employer-sponsored, because all of these programs, the costs are determined at some level by the prices that providers are charging, and the prices that providers charge are based upon what their revenue coming in is. If we have a drop in the number of people that are covered, will increase uncompensated care.
Right.
So we saw the impact of this in Wisconsin, where uncompensated care from 2013 to 2015 dropped by 40%. That really does help to lower healthcare costs because hospitals have a place to bill it.
Yeah, people gaining insurance under the Affordable Care Act and employer-sponsored insurance and through Medicaid.
Right.
And from 2013 to 2015, right when the marketplaces were open and people were buying insurance, the hospitals saw the benefit of that.
Yeah, and this is just hospitals. We're not talking about the clinics or other places as well. And there's a consequence to uncompensated care that spills over into billings and collections and not being able to pay other bills because you have medical bills, court costs, bankruptcy. This is a big deal, and I think it's often underreported and not understood as well how uncompensated care really is a driver of a lot of pain throughout the system, both for the hospitals and for the patients.
Yeah, the local economies, the state economy, it has an impact that is almost unmeasurable. It really does reach into every sector.
Yeah. So let's talk about some of the bad aspects of this bill. It was written in secret. I mean, come on. This is not the way to legislate. We all know that the Senate did this in a way because they knew it was going to be politically unpopular. Again, they're kind of living on their talking points from 2009 and 2010. They haven't evolved with the American people who have, for the most part, recognized how bad pre-existing conditions were.
Yeah.
Recognizing that Medicaid is part of the fabric of our safety net, and it extends not welfare program, but it cares for seniors in long-term care, people with disabilities. It promotes better access for children, which is important to get them off to a right start so they have less expensive health care going forward.
Right.
So we're kind of returning to the bad old days of the pre-ACA of insurance regulation. We eliminate the gross profiteering by some insurance companies that with the medical loss ratios, those would be eliminated. And it gives the states
caps, annual limits, a lot of the bad state-imposed regulations on consumers, the consumer protections. We're going to lose those.
Yeah.
We're definitely going to lose those. And we've talked about some of these other concerns throughout the course, but it can't be said enough that this is a bill that's targeting everyone, but it's certainly cutting benefits from the most vulnerable.
And it's likely it's going to cause disruptions and increased
deductibles. The CBO report said as much, that we're looking at increased disruption, and you can count on higher premiums, higher deductibles, and declining competition in the marketplace. The exact opposite intent of what the Senate said in their talking points when they started drafting this. Next steps, the Senate's got to vote on this.
We know that they already kind of pulled it back. They realized that the public was not behind them. The Senate was not behind them. There was a lot of discord. This thing has about a 20% approval rating from the American public, so it's a real dog. Yeah. And they need to do a lot of work. And at some point, it's time maybe for the adults in the room to sit down and talk across the aisle, develop some compromises, and move forward, because this is really important for a lot of people.
And it doesn't have to be this bill. What a lot of legislators are saying is scrap this whole repeal idea, and let's look at the ACA itself.
Some Republicans are saying that just get rid of this and let's start over.
And let's just look at the Affordable Care Act now and tweak some of those things that need tweaking. Put back in some of those market stabilization risk corridors and risk sharing that helped stabilize the marketplace, but we're set to sunset under the Affordable Care Act. Bring them back. Look at the family glitch. Look at ways that we can make insurance affordable. How can we increase competition instead of throwing it out the baby with the bathwater and saying instead we're just going to cut Medicaid? So there's some room for improvement here.
And there's going to need to be leadership at the Senate, the House, and from the President. I mean, the President has to stop pretending he's an insult comet. Can be a leader. It's just ridiculous.
It's not getting anywhere.
Yeah.
This procedurally, this is a bill that only needs a simple majority. They're using budget reconciliation rules, hence the name Better Care Reconciliation Act, which means no filibusters allowed. They just need over their 50 votes, and they can get this. But then they got to reconcile with the American Health Care Act.
They were driving their steamroller, but it really is starting to run out of gas, because this thing they could have steamrolled right through. The Democrats did it basically under the Affordable Care Act in a more open, transparent way, because there's a lot of public hearings
and
but
different process.
It still was no Republican participant. I think we've got to figure out how to bring leadership within the parties together to come up with a plan that's going to be good for the American people, and hopefully that'll translate into benefits here in Wisconsin. We know that there are some limitations because we didn't take Medicaid expansion, but I'm still optimistic that we can get to a better place.
And there's still time to take Medicaid expansion. We could see an instant improvement. We're sharing a lot of links with you in this video. The bill itself, if you want to read that bill, the CBO report in its entirety, and then there's extensive media coverage. Some of those sources and numbers that we cited, we're giving you the link where you can read that yourself. Of course, you can always share your own ACA or Medicaid story. You can click on the information button, send us an email, tell us your story. Those stories resonate with legislators. What Medicaid means to you and what it means to have your pre-existing conditions covered.
Right, and expect there will be changes over this 4th of July weekend coming up, the longer weekend if you're taking Monday off. There's going to be some negotiations, some horse trading, but I think that making sure that you speak up, make sure your representatives hear what your perspective is, because this is important. It does affect everybody.
Right, and we'll keep you posted as we learn more as well. Thanks for joining us.
Bye-bye.